Morgan is a 20-year-old female who frequently smokes marijuana, which is impacting the relationship with her significant other and causing them to argue often.
Hi, I'm Rachel.
Hi.
I'll be your nurse today.
Nice to meet you.
Okay, so while we're waiting on the doctor, do I have your permission to ask you some general questions about substance use? It's a standard procedure here at the University Hospital.
That's so.
Alright. In the past year, have you had 4 or more drinks per day?
No.
Okay. In a typical week, do you have more than 7 drinks?
No. I only drink, on special occasions.
Okay, that's good. I'm glad to hear you limit your alcohol use to special occasions. Now, can we talk about drug use?
Sure.
Okay. Are you a regular tobacco user?
No.
Alright. In the past year, have you used pot, street drugs, or prescription drugs for non-medical reasons?
Yeah, I smoke marijuana.
Okay. In the past year, have you drank more than you needed to?
Nope.
Okay. In the past year, have you thought about cutting down on your drinking or drug use?
Nope.
Okay. And in the past year, have you been intoxicated on drugs or alcohol when you thought that you could hurt yourself or others?
I don't know, probably.
Okay.
The nurse assessed Morgan to be in the higher probable risk category with assessment to be determined.
Okay, so now is it okay if we talk a little bit more about your marijuana use?
I guess so.
Okay, tell me about your marijuana use.
What do you want to know?
Like, how often would you say you smoke?
I don't know, every day after work and stuff.
Okay. Can you talk to me about your decisions to smoke?
I don't know. Balancing school and work is really hard, and I need something to manage my stress. Me and my boyfriend are having problems, and I don't know, I like it.
Okay. Well, I'm sorry you're having a rough time. Balancing everything can be overwhelming. What are you and your boyfriend having problems with? Can you talk to me about it?
He just really annoys me a lot. We've just not been getting along.
Why is he annoying?
He's always complaining at everything I do. I feel like he has a problem with everything, and he always wants to hang out with me, and I don't want to hang out with him all the time. He always wants me to go do stuff with him after work, and I don't have time for that, and it's really stressful.
Okay, I can see how that won't help your stress very much. So what does he complain at you about?
Just everything. And I don't know. He just doesn't like anything that I do, pretty much. And I don't really even know. I guess I never really thought about it.
Okay. So do you think maybe the difficulty that you all are having is related to your smoking? Or is he okay with you smoking?
Yeah, no, he doesn't like that I smoke at all.
Okay. So how do you feel when he complains at you about it?
Like I was saying, I get really annoyed. He's really annoying. That's pretty much it.
Okay. So do you think that maybe he's just looking out for your health? Maybe he knows that you using marijuana can contribute to your anxiety and is trying to help you reduce your stress by spending time with you?
Yeah, maybe. I guess I never really thought of it like that.
Okay. So I understand that this is how you handle stress in your life. However, your marijuana use is above safe limits, and I'm concerned about how it's going to affect your health in your personal life. So did you know that marijuana use can increase your blood pressure, breathing rate, and appetite? And it can also cause short-term memory loss, anxiety, and depression. And it can even be a risk for causing lung cancer.
I didn't know all that. Wow, that's a lot of stuff.
Yeah, and I just want what's best for you. So is it okay if I give you some advice?
Yeah, that'd be okay.
Okay. So I would like for you to consider cutting back on your marijuana use, and I will be here to help you with those strategies.
You will?
Yes. So, do you think it will help the stress in your life to cut back? I think that your use may be contributing to your anxiety and stress with balancing school and work in your relationship. And I want things to get better for you.
Yeah, I think cutting back would help my life a lot. And I really want things to change too because I can't take it much longer.
Okay. So, what do you think some of the pros and cons of your marijuana use are?
Pros, it helps me relieve stress, helps me sleep better. Cons are really the only kind I can think of is that me and my boyfriend are having problems. He doesn't like it, I guess. And it is money that I don't have.
Okay, so, alright, well, you're doing good at considering pros and cons. So now, on a scale of 1 to 10, how ready do you say you are to cut back?
3.
Okay, so what would it take to move you from a 3 to a 4?
I guess I just need to find a new way in my life to balance everything I have going on with school and with work and my relationships. And I think ultimately I need support from my boyfriend.
Okay, that's a great way to look at it, and that's a great place to start. And I agree that you need support, and I think he would be very supportive in you cutting back. Do you agree?
Yeah, he would love that.
Okay, great. So can you think of any ways you can cut down your marijuana use and start making progress towards your goal?
I guess I could start with doing things with him when he asks me to, spending more time with him.
What does he ask you to do?
He always wants me to go to the gym and work out and swim with him and stuff like that.
Okay, that sounds very relaxing and stress relieving at the same time. Plus, you can spend time together. I think that's a great idea. Is there anything else you can do?
Well, I guess another one of my cons was that it's a lot of money spent, so just stop buying it, stop spending money on it, and if I'm going to the gym with him after work instead of going and smoking, then I won't have to buy it, so that'll take my financial stress away.
Okay. So would you like to write down some of your goals so that they're set in stone?
Okay. That's a good idea. I should hang this up on my fridge or something. My boyfriend will probably want me to laminate it. Okay, I think that's everything.
All right. So would you like to read it to me so we can go over it together?
Okay. Well, I'll start by going to the gym with him when he asks me to after work and doing that instead of smoking, which will help our relationship and help with stress because swimming is stress relieving.
Yes.
Then stop buying it and stop spending money on it. And then I'll have more money. Yeah.
Yeah. All right, you're on the right track starting this plan. Now, when you're ready to quit, call this office and I can help refer you to one of the programs here at the hospital. And these programs will give you steps to quit and be of great use for you. Thank you for having this conversation with me today, and I think you made some great progress.
Thanks. Yeah, I'm really glad I talked to you about this. I probably never would have realized any of this on my own, and I'm glad I have this paper now. I'll keep this in mind every day. Thank you.
Let me know when you're ready, okay?
I will.
Have a good day.
Thanks, you too.
The nurse predicts that Morgan may be going from the pre-contemplation stage to the contemplation stage. At first, she didn't see reasons to change or have intentions to take action in the foreseeable future. However, after the conversation, she seemed to understand that it could be the reason for the problems in her life, and it was a little more apt to understanding the pros for change. She seemed to have a desire to replace her uses with the swimming with her boyfriend.